Good evening, everyone. Today's video will be on Warfarin or Coumadin monitoring form. A form like this is used by the clinical pharmacist and hospital pharmacist for dosing warfarin at the hospitals in America. The purpose of making this video is to help the international pharmacists and the pharmacy students to establish clinical pharmacy services at the hospitals around the world so that they can also establish hospital pharmacies in their places. We'll discuss about how this form is used and what are the components of this form, and we plan to make a different or separate video later about the policy and protocol, how warfarin is dosed based on the hospital approved protocol. That we'll do later, so please subscribe to the channel so that you can get those videos in future too. But in this video we'll only discuss about the form and what this form contains and how this form is used. Here is an example of a warfarin or Coumadin monitoring form. The top right hand corner of the form, where you see an empty space, you can write down the patient name, date of birth, the age, and the room number of the patient at the hospital. At the place for writing prescribing physician, you can write down the physician name who is ordering the Coumadin for the patient, and then the height and weight. Looking at the weight sometimes helps to determine if the patient will need higher or lower dose of warfarin. And then you will write down the indication for which the warfarin is indicated or ordered for the patient, and that could be AFib, which is atrial fibrillation, or AVR, MBR. The R for the AVR or MBR can mean replacement or repair. So you have to look at the physician's progress note whether the AVR or MBR means atrial valve or mitral valve replacement or repair, and you also have to look for whether the valve replacement is by tissue valve or mechanical valve, because the goal INR can be different for tissue valve and mitral valve, which normally for tissue valve is goal INR 2 to 3, and for mechanical valve the goal INR is 2.5 to 3.5. And you can look for any physician specific goal INR if the physician prefers a specific INR goal for the patient. The other indications for warfarin can be DVT-PE or cardioembolic stroke, or some patients may have protein C or protein S deficiency, or it can be factor V Leiden deficiency. So you will write down any one of those indications for which warfarin is indicated for the patient at the place of indication, and then you will write down past medical history, where you will basically want to put all the cardiac conditions of the patient like CHF, CAD, AICD, or if the patient has any other conditions that may affect warfarin dosing. And then you will write down the goal range for the INR, which can be 2 to 3 or 2.5 to 3.5 based on the indication. And then you will write down the medications. At the place of medications, you want to write down the interacting medications that interact with warfarin, so that it helps the pharmacist day to day to determine if any one of those interacting meds are discontinued or added to the patient profile, how to adjust the warfarin dose. And then there's a place for writing home dose warfarin, meaning what dose the patient take at home when they are not at the hospital. That helps to determine what dose to put the patient at the hospital. Then you have place for writing baseline PTT, baseline PT-INR, baseline hemoglobin over hematocrit. These are the values when the warfarin dosing is starting at the hospital. That's the baseline level, and we can see how the patient progress from there. And then place for writing date Coumadin teaching completed if the patient is counseled by the physician or pharmacist or the nurse about the Coumadin teaching, how to take the Coumadin when they get discharged. And then the creatine clearance of the patient. Creatine clearance helps in the sense that if the creatine clearance is less, the patient may need lower dose of warfarin, and if the creatine clearance is high, patient may need higher dose of warfarin. There is no solid science on that. It just helps to determine whether the warfarin dose will be on the lower side or the higher side. Then there is a place for writing the liver functions, baseline LFTs, and those values that we put here are AST over ALT, and then alkaline phosphatase, and then total bilirubin. If a patient's liver function is bad, meaning if these values are elevated, then patient may need lower dose of warfarin because their INR can be already high because of liver failure. And then there is a place for writing Charles-Busk score and the stroke risk percent. This value is not that much important for Coumadin dosing, but knowing this value helps to determine the patient risk for AFib and developing any stroke. So it helps to look at the patient's overall condition, but it's not that much important for dosing warfarin. And then there is a table for writing the patient's warfarin dosing day by day. First column is for date, and then the second column is for day number, which is important when the warfarin is being started at the hospital as a new start, meaning what day is the patient on from the beginning of starting warfarin at the hospital. But if the patient is already taking warfarin at home and this is being continued at the hospital, then this column, day number, doesn't carry any value because it's actually being continued from home. Then the place for writing dose, the column for dose, this is where you would write what dose you are ordering for Coumadin for that patient on that day, what milligram of warfarin you are ordering. And then there is a place for writing check here to confirm dose was given. So this helps the pharmacist on the next day to figure out if the yesterday's or the day before's warfarin dose was given or not. Sometimes you may just assume that the warfarin dose yesterday was given, but for different conditions, like if the patient is going for any surgery or any other condition like bleeding, the warfarin dose could be held by the nurse and you may not be aware of that, and you may think the INR that you are looking at is from the previous day's warfarin dose, but that may not be the case. This is why this column is important to put a check mark or write down if the warfarin was not given. Then there is the place for writing INR, the column for INR. Here you will write down the INR of the patient on that day. And then there is a column for writing serum creatine over platelet. Serum creatine value is important because if the serum creatine is high, that may mean the patient has renal issue, renal failure. And when the patients have renal issue or renal failure, then they tend to need lower dose of warfarin. So you look at that as the patient progress, how the serum creatine is trending. And the platelet value is important, we can understand, because platelet is related with the clotting. So if the platelet value goes very low, specifically if it goes below 100, then the pharmacist should check with the physician before dosing any warfarin on that day, if the warfarin should be on hold on that day because of low platelet. Then there is the place for writing hemoglobin over hematocrit. A low value of hemoglobin over hematocrit sometimes may mean the patient has some type of bleeding, or if the patient hemoglobin over hematocrit is low, that may give the clue that patient may need lower dosing of warfarin. All these values that are on this chart helps to determine a patient warfarin dose in a relative manner, meaning like you have to consider all these values together. Just by one value, looking at one value, you cannot tell what the warfarin dose should be on that day, and you try to look at the trend and how the patient is responding to the warfarin dose in the INR values, and then you determine whether the dose should be increased or lowered for warfarin on that particular day. At the column for notes, you want to write down some important notes for the next day's pharmacist so that it helps them to determine what to do warfarin dosing on that day. Let's say a patient is going for surgery on such and such day, you want to mention that, then you can know that warfarin should be on hold until then. Or if there's a note from the physician that warfarin can be started after a procedure on that day, then you would mention that so that the next day's pharmacist can figure out what was the plan from the physician from days before. So this type of notes you want to write down here about warfarin dosing. Like if there's an antibiotic added to the patient profile which severely interact with warfarin, then you want to mention that here so that the next day pharmacist can be aware. Or if there's a medicine that is discontinued from a patient profile, like the patient was on amiodarone and amiodarone is discontinued, so you want to mention that here so that the next day the pharmacist knows that the interacting med is gone from the patient profile. So all these important information that may help warfarin dosing you want to put at the notes column. So warfarin dosing by a pharmacist at the hospital depends on the pharmacist's experience and patient's home dose of warfarin, and then looking at the trend of the patient in the INR based on the doses of warfarin that is given to the patient, and then what the physicians are writing as the patient is progressing in the hospital and what is their plan of taking care of the patient. So all these values and parameters needed to be considered when warfarin is dosed by a clinical pharmacist at the hospital. So this is how this form is used, and as the day goes you keep on more and more rows filled for the date for warfarin dosing, and this can be copied for the additional pages if the patient stay in the hospital for a long time to be carried to the additional pages. So please subscribe to the channel so that you can get the videos about warfarin dosing guidelines which I plan to make it in future. So see you next time. Thank you.